Alrighty, so hello everyone, and a really warm welcome to Positive's YouTube live discussion. My name's Sinead. I'm joined by my colleague Brian, and today's discussion has come about really in celebration of the fact that it is Mental Health Awareness Week. And over the course of the next 30 minutes, Brian and I are going to be exploring some of the questions that we've had submitted from you guys on psychological health and the challenges that you're currently experiencing. I'm going to have to tell Brian to turn off his emails in case we have any notifications pop up.
It's done. Pardon.
But Brian, so in terms of the questions that we've had submitted, there's different themes emerging that people are, they're very timely, they're very topical, but I thought it'd be quite nice to start with this question, which is really related to the theme for Mental Health Awareness Week this year, which is the theme of nature. I think this is a really interesting one to explore. So the question that we've had come through is, what benefits do walking and venturing out into nature bring from a mental health perspective?
Well, I think all the evidence suggests they're very good for us. And being out in the countryside, actually being connected to nature, I think it's what evolutionary biologists and psychologists sometimes call a human universal. So these are things that are characteristic of humans all over the world. And you see this with certain things like attachment, love. You see it with music. You see it with exercise. And I think these are things that can nourish the human spirit. So I think nature falls into that area. And I think, historically, we only came out of Africa 60,000 years ago. We were hunter-gatherers for the previous 2 million years. And I think that meant you wandered around a lot, probably 6 to 10 miles a day, foraging, nuts and berries and things to eat. You had to connect with nature and you had to understand nature. You had to live in nature. And I think for a lot of us, not for everybody, but for a lot of us, I think it's a thing of beauty. I think it has a spiritual component. It's like poetry and music. I think it just taps into something that's very primal, very basic, and it's beautiful. And I think it nourishes our spirit.
And I completely agree. I think it's really interesting to think about that kind of hunter-gatherer connection and how important it is for us to actually be physical and to move and to get outdoors. And I think intuitively, many of us understand that actually it's really good to connect with nature and to immerse ourselves in nature and to be outdoors. But I think what's really compelling is that we're now generating a really strong and sound evidence base, which is demonstrating that actually being outdoors, being in green space, has a really positive and long-lasting impact on our psychological health and our physical health. So the evidence and the data is there to support this as an intervention. And I think that's interesting. And some of the mechanisms that underpin that link, we're learning more about. I think your one about physical activity is a really good one. I think another one that's useful to consider is how it influences our focus. Because sometimes if I'm feeling worried or stressed or anxious, my thoughts can kind of spiral and they can run away with themselves. And actually going outdoors, it really forces us to engage our senses in a very different way. So there's different smells, tastes, sounds, different textures, etc. And actually that can be a really helpful way of shifting my focus out of my own head and into the world around me. So that process, I think, is just a really, really nice one. The stuff that I've been reading on this in relation to bathing in Japan and how actually this has been become a governmental policy to connect with nature. And there's lots of different forests that people can access, which is brilliant. And it has been shown to help physical and psychological health. And what you see is that even in Scotland now, we know that GPs are recommending nature walks as a treatment. So the reason that they're doing it is because there's that really well established connection between getting outdoors and feeling good.
Yes, and I think exercise in and of itself does that. I think interestingly, I think this links to another sort of pattern of associative learning. I think when humans are feeling depressed, we tend to do less. We tend to avoid and withdraw. When we're ill, we tend to avoid and withdraw. And basically, one of the things you see when people are either physically ill or psychologically unwell is they often feel tired and they often stop doing things. The problem is stopping doing things is then associated with feeling bad. And we know the less we do, the worse we can feel. And I think one of the best treatments actually on the planet for low mood is behavioral activation. And many people use exercise, walking, or yoga or other forms of exercise, cycling, to lift their mood. And part of the reason for that is that when you behaviorally activate, when you're active, you change your neurochemistry. You push up a whole range of chemicals, including endorphins, but also you push up a chemical called brain-derived neurotrophic factor, which actually improves concentration, memory, decision-making, and actually it lifts the spirit. So I think walking and being active are part of feeling healthy. I think avoiding, withdrawing, being inactive are deeply associated in our brains with feeling ill.
And it's fascinating. And I certainly know that from a very felt sense. Like for me, it's so important that I make a habit of including a good exercise regime into my daily routine. So I think that's just really interesting to consider at a personal level. What form of exercise works for you, I think. And the second question we've had come through, Brian, is again very topical. So this is on the theme of work from home and how 14, 15 months of this, people are feeling a little bit fatigued. So the question is, how do you manage work from home burnout whilst maintaining productivity?
Well, I think the first thing is to understand why this might have happened. And I think there are lots and lots of good reasons why this has happened. If you look at the prevalence of psychological problems in our community in the UK, and this is really good data from the Office for National Statistics and from the UCL, it demonstrates that about a third of us are experiencing significant levels of anxiety or low mood. Studies here and in the US show that over 50% of people feel that the pandemic has impacted on their psychological health. So I think that's the first thing to mention, is that when our mood drops or we're feeling anxious, it changes how we think about ourselves. It changes how we think about the world and the future. But it also is often associated with fatigue because it's exhausting. We don't feel good. So I think that's one factor that has to be put into the equation. I think bizarrely, we're working from home as we've increased our working hours. So I think what's happened is that people are no longer doing that commute into work. I think the commute in some ways, although it could be squashed and sometimes dreadful, it did bookend our day. We had a time to start and a time to finish, and you could decompress on your way home, and it creates some boundaries. I think what's happened is that our home life can sort of bleed into our work life, and work life can bleed into our home life. And I think that can create all sorts of problems, particularly if you have family at home. It can create what's called a role conflict, where you feel you should be looking after the kids when you're working, and when you're working, you feel you should be looking after the kids, which can just increase our levels of stress and worry. So I think it's very understandable. And I think Zoom, or not Zoom, but doing this, taps into a different sort of level, and I think it is more exhausting than face-to-face stuff. So I think there's lots of reasons. And I think the other big factor we have to put into this equation is social connection. We've been socially distanced, and that nourishes our spirits. So that's probably undermined things as well. But I think it's creating some really good rules. I think that's one of the antidotes, is create those boundaries, create a structure, and actually be quite clear with yourself about how you're going to structure your day. Because the lack of structure means that you just start working longer and longer hours. What are your thoughts, Sinead?
I think this is a really interesting one. I think if you cast your mind back to March last year, many people got quite excited by the fact that they were going to have a commute. So people started to think about how do they spend this time in different ways. And there was all sorts of things, from early morning yoga, different activities that people were initially including into their day that were quite beneficial. But I think what we've seen over time is an eroding away of that. And actually the workday starting much earlier, finishing much later. And a lack of respect for boundaries in our own lives, like at a personal level, but also at a group level. So we've started to maybe pop meetings into the calendar for maybe 8 a.m. that we wouldn't have done traditionally when we were in an office. So I think for me, this is all about developing good adaptive working practices regardless of the future landscape of the workplace, we know that it has forever shifted. So I think tuning into what's best practice, how do we keep ourselves well, how do we sustain good performance over time? And I think your point's right about boundaries and good habit formation. So at an individual and a social level, how do we in our teams and our social groups create the conditions that enable us to manage stress, manage workload, and stop that kind of, as you talked about, that kind of splurging between home and work? So how do we kind of be very mindful of negotiating those movements? And I think the answer does lie in a balanced approach. It's about doing the things that we know are good for us, recovery, rest, breaks, self-care, self-compassion, your point about exercise, looking after our sleep, all of those basic foundational pieces that kind of help with this. And a really interesting one, I think, that's kind of come about more recently, is the idea of kind of creating or manufacturing a commute time or space. So if you're not actually getting on a train or in a car or on a bus to get to work, can you spend that time in a way that's actually quite helpful? And to your point, Brian, kind of helps you to bookmark or bookend the start, day and end. So definitely, I think it's something we need to hold ourselves to account to both personally, but also collectively. So I'd just like to say at this point as well, if you're interested in finding out more about positive in the work that we do, we're going to put a link to our mailing list in the chat. So please do follow us if you want to find out more. So Brian, the next question, we'll keep going at pace through these if possible. The next question is again very timely, and this is about personal differences as we emerge from lockdown. So in England, we're going to be allowed to hug people from next Monday, which for me is great. I'm a hugger. I'm really looking forward to this. But what we know is that people have really different feelings about hugging, about physical contact after all this time. So there is a level of risk still there, both kind of real and perceived. But many people want to hug. They want to kind of get back to your point about the social connections. This is really important to us. So the question that we've had come through is, how do we best navigate everyone's different feelings around this as we come out of lockdown on this roadmap?
I think for me, it's about recognizing that we're all different and we've all had different experiences. And I think we've come out of the back end of this with, different things that have happened to us, and its impact will be different. But also we're all different anyway. So if you think about the concept of neurodiversity, if you look at things like anxiety or worry or low mood, they sit on a continuum, and we sit on sort of standard deviations off the midline. And I think some people are much more anxious than others. And I think when you look at return to work and hugs and physical contact, I think there's a really important respect process when you ask people, is it okay? Are you happy with this? And I think it should almost be part of our sort of protocol, if you like, for returning to work. It becomes routine, because I think it's just about respect. It's just about understanding the other person's preference, and understanding that preference and respecting that preference is important. I think if you can then create a supportive environment where people feel safe, what will happen through vicarious learning, and hopefully with COVID, drifting into the distance, people's beliefs about the dangers and the fears and the concerns will start to evaporate. And this is a sort of graded exposure really back to a normality. And I think creating an environment which is comfortable, people feel safe, but then after a while, we're re-engaging in those normal social activities, which are stonkingly good for us.
Absolutely. I think it's really interesting, this theme of physical touch and social connection. We do a lot of this in our work at Positive. But I think if we look to our kind of closest primate relatives and we look at chimpanzees, what you see in those groups is that touch is not just normal, but it's actually really socially vital. And research has shown that it kind of reinforces social bonds. It's really important as part of developing relationships, but also interestingly, that it triggers the release of endorphins. So the endorphins help us to feel good, to manage and reduce pain. So this kind of physical touch as part of social bond formation is really interesting. And as I said, I am looking forward to kind of being able to hug people again. It's important. But I think there's two things to consider within this. The first is that point about the risk. So we know that coronavirus is spread through that kind of physical contact. So the hugging as a kind of a higher risk activity, if you like. So there's that to be mindful of. So it's kind of like thinking, in my group, who are the people that are perhaps more vulnerable? How do I think about how appropriate it is to hug people? But secondly, I think your point about consent is absolutely key. I think we need to be having conversations with people, because we know that there has been an increase in levels of social anxiety for very good reasons and very understandable reasons, because we've all retreated from each other over the past kind of 12, 13, 14 months. So I think we need to ask people how they feel about physical touch, about things like hugging each other, and when we do meet up. And I think perhaps sometimes it's useful to even have those conversations in advance. So kind of over phone or text, if you're able to say, we're going to be meeting up next week, where are you with this? How do you feel about this? Because I think sometimes when we see each other face to face, then we're kind of leaning in for the hug. By the time we ask someone, is it okay? It can be really hard for them to say no at that point. So I think it's just, to your point, it's about being respectful of the fact that we're all different in this.
Yeah, I think that's key is before you act, just ask, is it okay? I mean, if you have a colleague who's got a child who's immunosuppressed, or a partner who's on chemotherapy, they're going to be much more vigilant, much more concerned for whatever reasons, or they've had a relative die. They're going to be much more vigilant about this process. And understandingly, they have a degree of fear avoidance. So they're wanting to stay away until they know it's safe. And I think we do need to respect that. And I think you have to ask the question. And then I think what happens is that if the pandemic shifts into the distance, I think people will become much more comfortable about getting back to normal behaviors.
I think that's absolutely key. It's really interesting to me how quickly our social norms adapt, because now I notice in myself when I'm watching a TV program and people do things like hug or shake hands, your brain kind of almost says, oh, this was filmed pre-pandemic, because we know that there's been this change even in how things are filmed, which is really fascinating. And so I think you're right. I think as we move through the next steps and the norms start to slowly adjust, then hopefully it'll help people to feel kind of more comfortable with the roadmap as well. Okay, Brian, another question for you. So the next one is on that theme about going back to the office. And the question is, in cases where colleagues don't feel comfortable in physically returning to work, so where we've got some who don't feel comfortable and some that do, how do we best deal with that dynamic? So just because someone chooses to not physically return, that doesn't mean there's anything wrong with it, and vice versa, there's others that do. So how do we, between these two groups, start to foster an acceptance of both scenarios?
I think, again, it links to this concept of neurodiversity. We're all different. So some of us are very extrovert, some of us are more introvert. I think it also links to what the experience that people have. I mean, some people might have had experiences that have made them feel very concerned, as we've touched on. So I think just respecting that process is, again, really important, because I think the danger is when people return to work, we expect everyone to be just the same. And I think realizing that difference is key. I think one of the concerns is creating a return to work that actually allows this new healthy hybrid. Now, whatever the organization decide to do and how they ratio that hybrid from working in the office and working at home depends on the sort of work that's being done and how much people need to be in the office. But I think it can be done in a way that is very, very supportive to people. So realizing that we all sit on that spectrum of extroversion, introversion, also on optimism, pessimism, on health anxiety, on social anxiety. A lot of us have developed those things. And if you've developed health anxiety or social anxiety, you may not want to come into the office. Now, I think, again, it's about not creating an apartheid. It's not creating a two-tier system where extroverts are welcome back, but people who've had less pleasant experiences with COVID or have higher fears around COVID then feel they're being treated differently. I think the flip side of that is if the organization creates a space where people feel safe to come back and you can get this hybrid learning, I think that's fantastic, because I think for a lot of people, they will want to avoid. Avoiding in the short term is okay, but if you avoid over long periods of time, it can start to have disadvantages because we can become lonely, isolated, de-skilled. And we know we get lots of benefits from social interaction in terms of collective intelligence, creative abrasion, bouncing ideas, but also building those social networks that are so important for human health, physical and mental health. So I think it's a really important thing for organizations to address and think about, how do you manage the diversity of your work population? There isn't one size fits all.
I think that's absolutely key, Brian. I think your point about variation is crucial here. This is a really difficult question to answer, and it's a really difficult topic for organizations to get the right solution to. And I think, we're going to have to learn, we're going to have to see how things unfold. But there's been a lot of variation in people's experiences of the pandemic. And some groups actually have been more disproportionately impacted by this than others. So you have that kind of difference between groups. And then you also have, as you said, the variations between people. So some people who are more introverted versus extroverted, very different feelings about kind of returning to the office, about working from home. And I think what we've seen is that we've seen people over the past kind of 14, 15 months doing their jobs incredibly well. So we've seen people working really, really hard. We've seen people in many cases maintaining a really high degree of productivity. So I think that as we return to a different way of working, as we kind of start to think about the roadmap for the future, we need to not lose sight of the things that have gone well over the past 14, 15 months. So where people have been given a higher degree of trust and autonomy, those factors are really, really important within the workforce. So we need to enable people to still feel that they have autonomy within their role, that they are trusted to get on and do their role. But I think you're right. What we need to do is think about flexible solutions for physical working, for virtual working, and then for a blend of the two. And I think on, to the point in this question, I think on acceptance of different viewpoints here, we need to hear what each other have to say about it. So if the introvert can hear the extrovert and vice versa, if someone who has an incredibly long commute and actually would prefer to do that just once a week versus someone who lives closer to the office. So we kind of need to get together in our groups and work out a way of working that enables us to be collaborative, to your point, but embraces the fact that there's not just one solution to this. And I think if we understand each other's realities and we can then co-create that roadmap and we start to kind of tweak it as needs be as we go over time. And so we're kind of learning from each other as we go on this journey. I think one of the interesting things is when we do physically come together. So when there is a time where we as a team or a group are physically getting together to understand how we make that as valuable as possible, because there's some activities that we know we do better when we're together. So your point about collective intelligence, and actually when we are thinking about problem solving, creativity, innovation, oftentimes those activities are done better when we're physically present and we can spark ideas off each other versus other tasks that we can maybe get on and do on our own. So I think being very mindful of how we use our time and trying to kind of set a course that enables us to get the most from that time together, the most from the time apart, and kind of figure this out as we go.
I think that's spot on. And I think there's another factor here, is that if you've developed a degree of social anxiety or health anxiety, or you've had bad experiences, and again, that diversity of experience is so huge. I think what one needs to do is create an environment that is supportive to people coming back. And one of the problems with anxiety of almost any form is it tends to create what we call fear avoidance. So we avoid the thing we're frightened of. Now, interestingly, when you avoid the thing you're frightened of, in the short term, that feels really good because you don't have to do it. Now, that doesn't matter whether it's going to the dentist or if you have a fear of flying, you avoid flying. So we can do those things. But the danger is the short term, it feels good. But in the long term, it can start to have a detrimental effect. So I think organizations need to understand that neurodiversity and the diversity of experience. And then what they can do is set up programs. This is what's used in psychology a great deal, which is a process of graded exposure. So you get people to do something that they can cope with. It's a small amount. They do it. They find they can do it. Their anxiety starts to drop, and then you go to another level. And this graded exposure of return to the workplace could help people actually find a middle way between avoidance and never going back to work, which could be detrimental to their health, their well-being, but also their employability, because certain jobs will need that return to the workplace. So I think helping people come up with a healthy hybrid, creating an environment that supports that process, could be incredibly powerful. And I think organizations that do that will get the support and the engagement of their workforce. And I think that will be a key to actually performing well as we come out of COVID.
And Brian, so kind of perhaps maybe what time for one more question before the end of the session, and linking back to the fact that this is Mental Health Awareness Week. So it is about raising awareness of mental health. It's about helping people to understand the things that they can do to look after and support their own mental health and well-being and that of other people. And you mentioned when you were chatting earlier that actually since the onset of the pandemic, we've seen in some cases a doubling or even a trebling of common psychological health problems such as anxiety and depression in the working population. Is there an opportunity to kind of use this moment in time to get mental health on the agenda, so to properly ensure that we're investing and diverting resources in the correct way to help support people? So my question is this a good point in time to actually shine a healthy focus on mental health?
Yes, I think it is. I mean, I think what I would emphasize is the normality of this. I mean, I think if over 50% of us have experienced a psychological impact from COVID, a detrimental psychological impact, then what we need to do is normalize this. And I think the problem is we historically in our society we've actually sort of stigmatized psychological health or mental illness. I think this is part of the human condition. Most of us are going to experience times of stress, anxiety, low mood. I think that's just what happens to us. I think what we then need to do is say, okay, what could we do to help people manage those periods more effectively? And I think rather than, and what we advocate at Positive is rather than waiting for people to become unwell, you can teach the same techniques that you would use if people did become unwell proactively. You can actually, these are life skills. And I think if people understand the risk factors for developing psychological problems, and they understand the protective factors that can reduce the risk of them developing psychological problems, I think that gives a sense of agency, gives a sense of autonomy. It starts to give you some things that you can do. And we know these things, there's very good evidence base that these things shift the dial, they help you. And I think there's a real opportunity to start, metaphorically putting this in the water, because actually if you do, the psychological health and well-being of your people will improve. And there's good data that psychological education, understanding these risk factors and protective factors, is protective.
I think that's brilliant, Brian. I think the normalization piece is really key. What we've seen for a number of years is a real stigma attached to talking about mental health and well-being. And actually, if we can show that actually this is a very normative process, we all have mental health, and it's really important to understand the factors and the variables which influence it. So normalization, and then your second point about agency. So knowing the things that we can do that are protective and doing them proactively as well as reactively. And I think where we can kind of get our families, our schools, our communities, our teams, our organizations doing things that are helpful and supportive and protective for well-being, then that's quite exciting.
Yeah, and I think one of the things that you and I talk about a lot is that a lot of people who get distressed then get distressed about being distressed. And your point about normalization means that say, okay, I'm distressed. I understand why I'm distressed, but what can I do to mitigate this? What can I do to help myself recover my health a bit quicker? Now, we know these tools and techniques are effective. They're not a panacea. They don't mean everything goes swimmingly well all the time. But what we do know is they help people recover their equilibrium quicker. And I think they are life skills.
So thank you very much for joining us. We're coming towards the end of our time. So being that it is Mental Health Awareness Week and the theme is nature, we would encourage you to get outdoors at lunchtime, after work, before work, if possible, access some green space. And as Brian was saying, get some exercise of whatever type works for you, and just notice the impact and the benefit that can have on your mood and how you're thinking, feeling and behaving. So thank you so much for joining us.